Can you hear me, Doctor?
Hello, please call me Sandra. Hello, beautiful. How are you?
I am great. I am so pleased that you came on to share with us and to answer some questions amidst this epidemic, this pandemic. And so I know a lot of people are scared. Our first time being in this situation. And so we want to calm fears by education, right? You know,
Right.
those answers. And there may be some things that have been put out or said or that you've seen that we may believe and it's actually a myth. And so I wanted to kind of touch bases on that. And so I'm going to start off with you introducing yourself a little bit more because I was given a small preview before you came on, but I want you to go ahead and share your history and the work that you do in our community.
Okay. Well, first, let me say hello, everyone. Good afternoon. And although we are in the midst of a pandemic, as you can see, I'm able to enjoy a little bit of my back porch today because we all are somewhat halfway quarantined today.
Yeah.
Um, so I'd like to just give you a little bit of background about myself. My name is Sandra Carr Melvin. I'm an epidemiologist by training. And so looking at these numbers, watching this pandemic unfold is really probably one of the things that we wouldn't get to see in our lifetime. And it's not something that you want to see, but it's not the first time this has happened. We had a flu epidemic in 1918. I will say a lot of people died, but we made it through. And I think that we will make it through this one, but I think we have to be very wise in what we do in order to make it through this one. We have to act in ways to protect ourselves. So, with that being said, I've spent a lot of my life in chronic disease epidemiology as well as infectious disease epidemiology. And I currently serve as an administrator for the Open Arms Healthcare Center here in Jackson. So, we are currently in the midst of the pandemic with everyone else, looking for supplies, trying to make sure we have testing, diverting our clients to places that can provide testing because we don't have the kits right now. So there are some issues related to what we're going through right now, and I think there's some ways to improve it. So with that, I'll stop, and then we can maybe have a more detailed conversation about where we are and what we need to do to get through this.
Yes. So you touched on knowing how to protect ourselves. Do you have, of course, we've heard wash your hands. Some say 15 seconds. Some, it's even some variations with that. Some say 30 minutes. And I had a friend that's a nurse that said we need to really do the 3-minute scrub. That's the longest I've heard. And it was the first time I heard that. But she said and then she also talked about the alcohol wiping of your around your nostrils, your face, and your ears. So I'm getting a lot of good information, but I don't want to panic. And just like the public, the audience doesn't want to panic. So I don't know if you are the subject matter expert in this, and you have a groundbreaking and years of experience. So that's why we really wanted to get you on.
Okay. Well, I don't want to dispute anything that a trained medical professional says. As I said, I'm in public health. What I will tell you is that traditionally, when we're handling things like the flu, we want to at least adhere to the 20-second rule, and keep your hands away from your face. Now, not everyone is going to walk around with alcohol pads. I mean, in the best case scenario, if you can wipe down with alcohol, I mean, it will do something. But I will tell you this, when you're doing things like using sanitizers, look at the label and make sure that it's at least 60% alcohol.
Wow.
Those are the most effective sanitizers. But really, the best way to keep from getting the disease is to wash your hands very well with soap and water, and keep your hands out of your face, away from your mouth, and make sure you wipe down all surfaces, including your cell phones. We have our cell phones in our hands all the time. We lay it down on surfaces, so wipe your cell phone down regularly, and that will also help to reduce the transmission. But the other thing is something that we don't like to do, and that we're going to have to do for now, and that's that term called social distancing. We all like to get out, we like to congregate, we like to see our friends, but at this time, in order to stop the spread, we're going to have to limit our contact with other people and where we're going. Only go where you have to go, because the flu is very contagious. This is a more deadly strain of flu. Coronaviruses are not new to us, but this particular strain is. And so, what we need to do is make sure that we're being careful. We're not taking this lightly, just like you would with any flu. You wouldn't go somewhere that you know everyone had the flu. So, with this, you're going to do the same thing. And really, if you are not immunocompromised, that is, if your immune system is working properly, you should be okay. You should just have symptoms of a cold, same as the flu. However, if you have elderly parents, grandparents, young kids, then you are a danger to them if you bring it back. So that's really what the concern is. It's not so much that we think younger people won't get it, so they're not at risk. But if you are infected, you could infect someone who could die from it. So you need to be careful about that.
So I want to put a disclaimer out there before I ask this question. There are several different types of products out there, and I came across a product called Microban. And because I care for an elderly parent, I made sure I got those things, because in between cleanings, because it said that it lasts for 24 hours versus the Lysol, because I was under the impression if you clean everything down with Clorox and Lysol, and I'm not, disclaimer, we're not disputing Clorox or Lysol, but I was under the impression once I mopped and cleaned that it was clean, and it would be clean for at least 24 hours. But according to Microban, that's not, true. So disclaimer, we're not supporting or rejecting any product, but can you give me some insight? And you don't have to call names, but just give me some insight in our audience insight about that.
Well, typically the best cleaner is what our grandmothers used, Lysol and bleach. And really, whether or not a surface becomes infected has nothing to do with the reagent or that you use to clean with. It's about the contact. So you can clean it with Microban, but if someone comes in and is infected and touches it again or coughs on it, then it's infected again. So really, if you clean it with Lysol, bleach, Microban, whatever, but you don't bring any infected materials back in, then you should be fine. The other thing is, a lot of people are, if they're going out, when they come in, they take their clothes off that they've had exposed, so that they don't bring it into their home. So once you do a thorough cleaning, if you're not going in and out, no one is infected, you should be fine.
Okay. Mm-hmm. Awesome. Despite us loading up on tissue and things in toiletries, what products or information that we need to load up on? I've heard everything from elderberry to vitamin D, C, E, you name it. Help.
Well, really, the best way to fight this is to do what you do every day: exercise, eat healthy. I can see some of the rationale for buying tissue, but in the event of us being quarantined, I guess the joke that I have around my office is, what are we doing? Eating the tissue? Mm-hmm. So at the same time, I also want to say, don't overreact to the point that you're not thinking about your fellow man, because when we go to the stores and we don't have tissue, we don't have cleaning supplies. Remember, we're living each day. So there's someone that does not have tissue today because someone went in and really just hoarded all of the tissue because they were worried about what was going to happen. And the reality is, something like being able to, tissue is not the real issue. Because again, I'm a real proponent of grandmother ways to address issues. If you really think about it, I mean, tissue, if you run out of tissue, you have towels, right? Mm-hmm. Use towels and wash them, so that's not going to be the problem. I think one of the issues is, if you're going to buy food in preparation for some quarantine, think about getting things that won't perish. I noticed that bread was missing from the stores. Bread has a shelf life of about a week or 2 weeks. So why would you hoard bread that you're going to have to throw out? And now people that need bread won't have it because you put it in your storage room and nobody else is going to get to use it. So at the end of the day, think about the things that will last. at least a month, that you'll be able to open and maybe eat without cooking if for some reason we don't have electricity or whatever, which I don't think will be the issue. But just think about things that you can easily cook while you're there. But to hoard toilet tissue, clean, I can see cleaning supplies because people want to disinfect. But those type of things, I don't understand why we're hoarding those at this
Right,
point.
right. And you made a very, very strong point. I know that you have extensive work in the community and you think community.
Mm-hmm.
Um, and I think that's one of the things that we're struggling with right now. And it's really showing who we really are,
Yeah.
because we we have to think community. We have to be community based. It's not my four and your and no
Right.
more. It's no, that's not the rationale right now. So I am going to let you take over and share any points or information that you want to get out.
Okay.
That's because our community really needs it. Yeah.
Okay. Well, thank you for that. One of the things that I just do want to do is give you a slight update as to where we are in the pandemic. As of today, I believe in the United States we've had 14,000 cases diagnosed, and maybe a little bit over 200 people have died from it. So I've heard things from people saying we're overreacting. To me, it's really an underestimate. In Mississippi, just today, 30 more cases were identified. So we're now at 80. And if you look at the map, the cases are spreading throughout the state. So it is an issue that you need to be wary of. Don't overreact, but understand that this is an issue, and we have had one death. Now, he was an elderly gentleman, but I think I've also heard some myths in the community about if you're in your 20s, you're not going to be affected by this. And that is absolutely false. We don't know what our immune systems are at this point. At this point, we assume because we're 20, we're okay. But a lot of things depress your immune system. If you're not sleeping enough, you're depressed. If you have allergies really bad, you're depressed. If you're taking some medicine that can depress your immune system, so you don't know that. So you can be 20 years old, get coronavirus, get COVID 19, and then end up on a ventilator. So for all when I'm seeing pictures of people still spring breaking, still, congregating in groups, you're still putting your risk and your communities at risk. So for a little while, just for a few days, if we could just stop doing that, we can halt the spread of the disease. The other thing I wanted to say is when you think about the other things that you need to be preparing for, not just getting toilet tissue, remember a lot of people will be out of work for a little while because of this. We're working remotely from home, but remember, employers have to know how to pay you. And for places like restaurants, they make money daily based on the people that are coming in. So now imagine if you're a worker at a restaurant, you don't know where your next check is going to be if your employer does not have a reserve for you because they have not made any money. Now, luckily, we have some bills going through the legislature right now that may address some of that. But the thing that you need to be hoarding, if you don't have to spend money on unnecessary things, I would wait to make purchases that you don't need right now because we don't know how long this is going to last. We don't know when people will reimburse employers so that they can make sure to pay employees. And then just understand that your lives are going to be changed forever after this is over. We are not going back to what we were before this happened. First of all, the economy is going to change. The healthcare system will be stretched beyond its limits at this point. There's another disturbing article that I read that I really want to put a plea out to people. If you donate blood, please do that. Remember, there are other things happening in the midst of this. There's a shortage in blood supplies right now. And so if you get in a car accident and there's no blood, you didn't get the virus, but you died because they didn't have blood to give you a transfusion. So there are a lot of different things that we need to be thinking about while we're planning for this crisis. Healthcare, if you're a healthcare provider, healthcare providers are trying their hardest to keep up with the demand. But the reality is we don't have the kits to test. We don't have the supplies, the face masks to be protected. So we're going to see also shortages in healthcare providers because once they get infected, they're out of the game. So we have to also remember those things. So that's another reason you want to stay healthy if you can and stay out of social settings because our healthcare providers are going to go, the number is going to decrease because they've been exposed. Once you've been exposed, you have to be quarantined. So there are a lot of things that you have to think about. What are some of the other things that I would keep in mind is when you're working from home, just make sure that you are recording what you're doing and that you're able to show what you've done just for
Yeah.
purposes later. There are a lot of organizations that will pull through, but there are a lot that won't. So we have to be thinking ahead, not just in the immediate, and also be good to your fellow man. You know, when you go to the store, get what you need, leave some for someone else. When you go to the store and you see shelves that are empty, that means someone else did not get something that they needed. And
Right.
we're all trying to survive through this time. And some people can't get to the store. I mean, some people can get up at 5 a.m. If I have to be at work, I can't go then. So when I get off at 5 o'clock p.m., there's nothing left for those people. And usually they're first responders that had
Yeah.
to go to work, and so now when they have to go home and feed their families or get supplies for their families, they had to get up and go to work. So they couldn't go to Kroger or Walmart or any of these places early and get what they needed. They had to go to work. And so when they get off work, nothing is there for them. So that is something else that we have to think about as a community, and just making sure to just practice safe social distancing. I think that's the biggest thing that I'd like to stress today.
For those who, because I have several people in my community that are still reporting to work, they don't have the option to work remotely. And some of
Mhm.
them are in offices, and some of them are on deck plates in refineries and things of that nature. And they are just really scared. They want their paycheck, but can you give them some type of guidance of how to safeguard themselves? You know, we know the hand washing, the sanitizing, but they're like, I really don't want to be in this meeting. I really
Mhm.
don't want to be in this meeting. Yeah.
Well, one of the recommendations is put adequate spacing between yourself and another person. Now they're saying 6 feet, but I don't know that you're able to space people 6 feet apart. The other thing is, if you can do a virtual meeting, do that. If you have to have a meeting face to face, no more than 10 people. But the reality is, many people in this time have switched over to virtual meetings because we don't want to take the chance of being in the room together at this point. And the other thing is, make sure you use your hand sanitizer, wash your hands. If you are sick or if you know employees are sick, please encourage them to stay home or send them home if they are sick. Don't let people come to work sick.
Awesome. Awesome information. I was waiting for anybody that had any questions. Everybody is just agreeing with you wholeheartedly and appreciate the information.
Thank you.
Um, Keep walking us through,
Thank
and
you.
stop at any time. But I just could not pass up this opportunity with someone with such knowledge, and to not have that out to our community. I couldn't pass that up.
Well, thank you. Another thing is the Department of Health has a wonderful website that you can go to. If you put in MSDH .gov, you should be able to get updates on the virus if you want to know how many people are infected if it's in your area. The other thing is, I can say many clinics, including Open Arms Healthcare Center, are going to remote uh, work. So what's happening is we're using telemedicine. And so what will happen is, even if something happens and you need to see a doctor, you can call in and they will make an appointment. They will first of all screen you for the virus to make sure you don't have symptoms. If it's something that they can do over the internet or via telemedicine, they'll do it that way. If they feel that you need to come in, they will screen you and see you. The other thing I think that's happening across the state is the University of Mississippi is working on um, a sort of a drive-through screening process at the fairgrounds, and that's in Jackson. So soon we'll have an area where people can come and come and get treatment, screened, or whatever is, get checked to see if they're infected. The most important thing I do want to tell readers, your viewers, is that right now, if you just are displaying mild symptoms, they are not seeing you in the hospitals. They're
Right.
asking you to stay home. So, a lot of people, when they feel sick, they go to MEA. What they're asking people to do is stay home. They only want to see the people who are really, really sick, and they want you to call ahead of time because they don't want you to be in the emergency room giving it to everyone else. So
I
please,
just got that question.
yeah, call ahead of time. Give them your name and let them know you're coming. And when you get there, if you go to the front, they will go ahead and take you to wherever they're going to take you right then. You don't have to sit in the waiting room.
So I got a question, and they were asking. It's a couple of things. They said some of the clinics with their jobs and their primary care,
Mm-hmm.
they do not come in if you have flu-like symptoms, nor if you think you have COVID-19.
Right.
Well, they said the next question was, so do I just go to the emergency room? Obviously, that's not an option.
No,
Okay.
no. What you will do is you will call, and then depending on where you are in the state, find out what your emergency room number is, and you will call that emergency room, explain to them you're having symptoms, and when you tell them, they want you to come if you're having respiratory distress. You're shortness of breath, can't breathe, you're coughing, you have a fever. And if you have those symptoms, then they'll let the people that are taking care of the issue know. And when you get there, they'll go ahead and put you in an isolation room. What you don't want is people who have those symptoms sitting in the waiting room, coughing, sick, giving it to people like someone else may be in there because they broke their leg. You're in there because you have the virus. So if you're in there because of that, now they're going to leave with a broken leg and with the virus.
Yes.
Mhm.
So for those who have mild symptoms, so do they self-quarantine themselves at home and take what? Robitussin, Mucinex?
Well, I think that the best thing to do is, first of all, yes, self quarantine. And then it is a flu. You're going to have flu like symptoms. So if you can have, and that's the other thing, we're buying toilet tissue. Let's buy some things for if you get a cold, if you get the flu. And you can call your healthcare provider. Now, let me just put that in there. Call your healthcare provider, tell your healthcare provider what's going on, and let them screen you. Let them tell you to stay home. Don't just decide that, oh, my symptoms are not very strong, I'm just going to stay home. Go ahead and call your physician or your primary healthcare provider. Let them tell you to stay home, and then use the regular things to kind of really make yourself more comfortable, because we don't have a treatment for it right now or a vaccine. But things like your Robitussin, Alka-Seltzer, you can take those to alleviate some of the symptoms.
Okay, y'all, if y'all have questions, I can't get my text and look at my messenger. Please post on the actual Facebook Live. So what if you just have a lot of allergies and you're already prone to asthma? And I think you just answered that. You said call your healthcare provider.
Call your doctor. But if you have respiratory issues, that is something that is a problem. So make sure you monitor that. If it gets worse, you can't breathe, then you need to call the emergency room.
Okay. Well, if there's not anything else, or if you think you've covered everything, I don't have any more questions from myself nor the audience. So just close us with last minute details, and we'll let you redeem some of your time back for today.
Well, thank you so much for having me today. I do just want to tell the audience, please stay safe. Practice good common sense when you're out there. We do have to go to work, some of us, and we also need to go to supermarkets and places. Just make sure to just properly protect yourself when you're out there, and minimize the amount of time that you're out there so we can slow the spread of this disease.
One last thing, and I think you answered this earlier. What can you do to keep yourself safe at your workstation?
Well, one thing is don't congregate by the water cooler. Just kind of stay in your own space. If you have to be at work, minimize interaction with coworkers, that kind of thing. If you have to have, if you need something from them, like I said, just minimize your interaction with them. There's not much you can do if you're in the building with someone, but you don't have to sit in their offices. Don't share coffee with them, stand around, and you just want to make sure that you maintain that space so that you're not in a place to be infected.
And I apologize. I'm kind of catching on to why I'm getting texts and messages, because some people don't want to be exposed because they're on their jobs or face people.
Okay.
And I just thought about that. So forgive me for saying please post on Facebook. So I know some of you all have concerns, and I'm trying to catch them through Messenger, my texts, and things of that nature. But one of the persons said, so they're making sure they use alcohol wipes on their chairs, their
Lysol,
and and all on their cubicle. And they said, other than that, they don't know anything else to do. So, yeah.
There's really nothing else you can do. And just to tell you about face masks, I know a lot of people are going out in public with the face mask. The face mask will not protect you. A face mask is really for the person who is coughing. So if you are coughing, if you are sick, if maybe allergies, whatever, that face mask is going to keep you from giving it to someone else. But the virus, you need a special kind of mask to make sure it doesn't filter through the mask. So the walking out in public with the mask is really not helping you as much as you think it is.
Yes. Thank you so much, Dr. Sandra Melvin. We certainly appreciate you for coming on and giving the community the information that we need to be vigilant and resilient in this time. So we appreciate you for coming on. Thank you.
I appreciate you too. Have a great weekend, everyone.
You do the same.
Okay. Bye-bye.
Bye.